So I think it's really important to have a residency program specifically in hospital pharmacy because you have to be trained at a pretty high level to make you best equipped for a hospital pharmacy job.
Working with the physicians here has been so great because you can tell that they really value pharmacists' input and they always take my recommendations and we can have good discussions, and I feel like I'm really making a difference here with the patients.
Being able to work as the clinical pharmacist for the entire hospital was a really good experience.
So in terms of the residency program as a PGY1, there were a lot of resources available to us, and I feel like I grew a lot under the leadership of our preceptors.
I think a clinical pharmacist that goes through a residency program would likely have great opportunities when they finish.
So when I was a resident, I did 1 year of, it's called a PGY1 for pharmacy. So that means I spend 12 months with the hospital and I do different rotations, including different specialties. So that could range from the cancer center to cardiology to internal medicine, family medicine. So it varies and you get a really well-rounded experience of a hospital from a learner's perspective. So I was a resident for 1 year and did that.
Well, I completed my PGY1 residency here with Franciscan Dyer, and then I went on to do my PGY2 in ambulatory care at Franciscan as well, and now I serve as one of the preceptors in clinic.
I love the people that I was working with. They really pushed me to grow as both professionally and personally. And so I think the friendships that I gained from my co-residents, from my preceptors, I just fell in love with them and I just wanted to stay. And luckily there was an opening. So a lot of our residents historically for our PGY2 program have actually stayed on. So we have a really great retention rate. Their confidence in me helped increase my self-confidence too and led me to the position I'm in today.
So the program is a 1-year residency program. The residents, they get to rotate throughout different sites, but they'll also get to learn different units and different types of pharmacy. So they'll have internal medicine rotation, they'll have infectious disease, ambulatory care, so they'll get to go to our anti-coag clinic and pharmacotherapy clinics. The skills that you learn while you do a residency here are unmatched. And if you look at all the pharmacists that we have working here, a majority of them did do residency with Franciscan, so they must have liked it enough to stay.
I think that the benefits of the Franciscan Health Residency for pharmacy is that the program here has great access to the various specialties that we offer here, as well as a great unopposed education, right? So there's not anyone else aside from the ER pharmacist working directly with the physician team.
The residency program trained me so well that I felt, I think, much more confident coming into my clinical staff pharmacist position than others because I had had one-on-one experience with the clinical specialists and I had already known the doctors and formed relationships there, so I felt much more equipped than someone maybe coming from a different hospital or coming from different experience.
So honestly, I loved my residency experience. My preceptors were always there for me. They were encouraging. They also challenged me to become a better version of myself and a better practitioner overall.
So we have residents at 3 regions in Indianapolis, Lafayette, and Dyer. And so we want to give them an opportunity to come together every couple of months and just virtually and having the different sites in person too as well. A lot of times our residents can have a lot of stress within the program. It can be really rigorous. So we're trying to decrease their burnout and also increase their resiliency too as well.
Our residency program is very vigorous and we want them to learn, but we want them to also be well while they're doing it.
Well, I would say all residencies are definitely challenging, but I would definitely choose ours again and again to have the same knowledge base, level of experience, and also the current career that I have today.
I would say that, if someone's interested in doing a residency program, it would be a great opportunity at Franciscan to be able to take your career to the next level. So the exposure that you would get here would really prepare you for that next opportunity that hopefully opens some doors and allows you to pursue a career that you might not otherwise have an opportunity to get into.
My advice to others considering the residency program is really just following your gut and your heart and your values. So go to a place that aligns with those things.
Franciscan Alliance was a great place for me to start my career and can be a great place for you to start your career.